Ammonia toxicity is the exam question we'll be answering this evening. So let's go straight up to look at the full question. All right. So they said that explain ammonia toxicity, then outline a simple protocol to be able to dictate it in a human sample. All right. So what they're requesting from you is, okay, what is ammonia toxicity? All right. How does it happen? What are the symptoms? Okay, then how to dictate in a human sample is like, okay, a patient came to the hospital and you're suspecting that there's ammonia toxicity, so probably took some blood samples, and what are the types of tests that could be done to dictate if there's what ammonia toxicity. All right, so that's what they are requesting from you. Okay, so first of all is for you to know that ammonia is the NH3. All right, ammonia is the NH3 and it has so many effects on the body. If okay, like it has so many effects on the body on the general. Do you understand? So if there's a toxicity of it, then you know that definitely to have some bad effects. Okay, so we'll be talking about the effects. That's basically the symptoms, right? If you have an acute exposure is exposure within a short period of time. Let's say a few hours to a day. Do you understand? The chronic exposure is when you have been exposed to an ammonia, let's say 2 days up to weeks. Do you understand? You have been exposed to very high levels of it. Okay. So let's talk about the effect. If there's an acute exposure, that's a sudden exposure to so much levels of ammonia. All right. There'll be respiratory distress. That means the individual will be having problems with breathing. There'll be neurological symptoms and the person will be confused for that time. There might be seizures, there might be coma. All these things, we're not saying all of them will be there at the same time. Do you understand? We're just saying if you don't see one, you might see one. Okay. Then there could be some cardiovascular collapse. All right, cardiovascular collapse. There's some gastrointestinal disturbances like nausea. That's the person who wants to vomit. Then vomiting is the ultimate word, vomiting. Right. Then chronic effects. Chronic, like I've explained, is when you have been exposed to something for over a long period of time. All right. So to lead to things like what hepatic encephalopathy, to lead to some neurodegenerative diseases like what Alzheimer's and Parkinson's, where the patient to be tremors, not be walking normally and all the stuff. Could also lead to kidney damage, could lead to cancer. All right. So what is the mechanism of toxicity? If I expose to ammonia, how can it be able to cause a problem in you? Okay. So it can cause things like what pH imbalance. So you know your body has a normal pH. So if you are exposed to too much ammonia now, it can go in, it has all those hydrogen, nitrogen. Okay, so it can actually disrupt the pH levels of the body. All right, so it can disrupt the acid base balance. Oxidative stress, ammonia generates what reactive oxygen species. Those are the ROS, and the ROS they basically they put a lot of stress. That's why they call them oxidative stress. They put a lot of stress on the cell membrane. Okay, it could cause some problems. Mitochondrial dysfunction. Ammonia impairs energy production. Okay, so you know that the mitochondria is the energy house of the body. So if you have something stopping mitochondria from performing a job, then you know that there will be no energy. Okay, the inflammation. Ammonia can trigger pro-inflammatory responses, can cause an inflammation in the body. All right. So sources of exposure. What are the possible ways in which we can be exposed to ammonia to a level where we are saying ammonia is now to a toxic level? All right. It could be industrial settings like fertilizer. Probably you work in a fertilizer industry, or you as a farmer you use fertilizer. All right. There's some cleaning products. There's some agricultural activities like manure, yeah, like applying manure on the farm, fertilizers, applying fertilizers on the farm. Okay, all these things, they have a high level of ammonia. All right, and that's why you see people using face masks, you see people using that specialized face masks and all that, just to stop ammonia toxicity. All right, so waste water treatment plants, let me say, in some countries they recycle almost everything. Okay, so let me say, even if you defecate, there's a way they can recycle it. Do you understand? So people that work in those industries, they deal with what, a lot of ammonia, so you can get what, exposed to it. Some medical settings like dialysis, surgical procedures that probably they use a drug that contain ammonia. Do you understand? You can be exposed to high levels of it. All right. So what are the risk factors? Like what could it cause? I think we have already spoken about what it could cause under the effects, right? So leave that one out. Now, coming to the next question now, which is what? What are the ways you can be able to what? Dictate ammonia in a human sample. You could do blood ammonia levels. That's you're doing a test to check for what, the ammonia levels in the blood. You are doing liver function test, kidney function test, then neuroimaging. You want to see if, we said that it causes some neurodegenerative disease like what, Alzheimer's and Parkinson's. So you want to look at the brain if there's any problem in it. Okay, so these are the tests, all right, to be able to dictate ammonia toxicity. So what are the treatments? Supportive care, the person will be having what, respiratory distress. So give oxygen, hydrate, resuscitate them, right? Medications that you could use include lactulose and what, rifaximin. Then hemodialysis in some severe cases, because we said that what, one, it can actually cause what, kidney damage. So if you have kidney damage, you now have to put the person on a dialysis so that what, waste is still what, being brought out of the body. Okay. Then liver transplantation, that's if it has caused an advanced liver disease. I just want to transplant. Prevention, proper handling and storage of ammonia containing products, personal protective or equipment use, ventilation and air purification systems, then regular medical checkups for those who have been exposed to what, high levels of ammonia. Right? So I think that's a comprehensive note on ammonia toxicity.